This is the MyHeart.net podcast. This show is produced by Dr. Philip Johnson in conjunction with VitalEngine.com. Please welcome your host, Dr. Alain Bouchard, of Cardiology Specialist of Birmingham, Alabama, at St. Vincent's Medical Center, part of Ascension.
Well, welcome to MyHeart.net, and today I think we're going to talk about a very important, subject, which is a journey of resilience from heart attack to heart transplant. And with us today, we have a very special guest because he's been my patient for many years and a friend for even longer. So with us today, we have Houston Dill. And Houston, thank you for taking the time and being here with us at MyHeart.net.
I appreciate the opportunity. I'm glad to be here.
So, Houston, when I met you, you were just in your 20s, and you were running this little company called Dill Communication, which was very good. It was the time where cell phones were really taking off, and you were this young man, very ambitious and hard worker. And you had this little bout with atrial fibrillation. Can you tell us a little bit how did that present, and what were your symptoms at the time?
Originally, it presented much earlier than we got started. I was actually still early 20s in the military, and I had the symptoms. And I actually presented with the dizziness, lightheadedness that you'll get with it. And I saw doctors about it, but it was a come and go thing. It wasn't there all the time. And while I think they might have heard it once or twice, they never said you have atrial fibrillation. They just didn't. And that proceeded on. I got out of the military and went on to be hospitalized the first time around age 24-ish. And then I found you, and you listened and you put a harness on me, and we finally had a diagnosis and began to treat it, which helped a lot in the beginning because it was impacting my quality of life and my ability to perform my duties as both my work and my family. Well, that rocked on, and it got to the point where the medicines just wasn't doing it. And it got to the point where I was in atrial fib more often than I wasn't. And you referred me to Dr. McGiffin, who was doing a thing called the MACE procedure. You might can explain more what the MACE procedure is, but basically they get rid of the bad pass where the electricity is causing your heart to beat wrong. I did really well with that. Honestly, I was very shocked at how quickly I recovered from that and got to feeling really well. As time went on after that, I went to getting back in shape because I had been in shape. I've tried to stay in shape my whole life. I got back in shape after the MACE procedure and did very well. Didn't have any real problems after that. I think my EF had come up to 50 at that point in time, and continued to work, raise my family. Actually, 6 months after the MACE procedure, I had gotten to feeling well enough and in good enough shape that I was playing a competition paintball on a sponsored team, traveling around the Southeast, and it's a speedball where you're running and dodging and all that. So it was a remarkable experience to have had that MACE procedure. It really may have changed my life.
Of course, that was over 25 years ago. We have so many kind of newer procedure now that are, not requiring the MACE procedure. But, this was surgery that you had. Dr. McGiffin, one of the greatest cardiovascular surgeon I know, now is back in Australia, but, did a marvelous job. Now, of course, we have all these new techniques of atrial fibrillation ablation, but it was very unusual to be a 20 or a late 20-year-old with atrial fibrillation. And you and I are probably not quite finished in the investigation of this. It's really unusual. and we need to make sure that you didn't have kind of one of those gene or genetic predisposition to AFib, which we know now there are certain genes that can make you prone to develop AFib at a young age. Be important mostly for your kids. So we'll need to pursue this and do some genetic testing with Dr.
Yes,
O'Rourke.
I'm very interested in doing that,
Yeah,
actually.
I think it'd be important. Well, you were doing well and in pursuing this. Then you had this bout with CLL or chronic lymphocytic leukemia, and
Yes.
this was so unexpected, but it was like almost like a major speed bump, and because you were still young, and it's rare that it occurs. It occurs most frequently when you're 65 years old,
I
but
was
young
44.
men, 44 with
Mhm.
CLL. Tell us what kind of symptoms did you have at that time, and how was it? What
It,
treatment?
I really didn't know what was going on. I was having a hard time breathing, uh, and fatigue. And later, come to find out the reason I was having a hard time breathing is because my lymph nodes were swollen with the cancer, which was making it hard to breathe. I went through a doctor, and it took a minute to get that diagnosis correct, and uh, got to the oncologist. I was much later, much further along than what she would have liked me to get to her at that time, but um, it was rough. No doubt, it always is with cancer. I did have to go through chemo and quite some. I don't know the name of the drug. I just know that once it leaked out on my hand from the IV, and it gave me a burn on my hand. It was a very mild burn because the nurse was right there, and she knew what would happen, so she did right. She got it off my skin. So that's when I learned that the insides are way tougher than the outsides of you. I was very amazed to learn that. That took me 6 months to get into remission, which was very quick for CLL. I had been in really good shape then as well, and so I think that helped me. I also, applied uh, positive thinking and deciding to get better, cut myself off from all the other options. I know that may sound corny to some people, but I believe it helps impact one's results, and at the very least, it improves your quality of life.
That
Uh,
is that's so true, Houston. I mean, patients with cancer, whether it's a woman with breast cancer or a man with prostate or any other type of cancer. Number one, this active lifestyle that you had was so important in just kind of making you kind of a better fighter, of this cancer. So it was your physical conditioning, it was your healthy lifestyle, as well as this, positive thinking that really helped you beat this cancer, which is pretty fantastic. Of course, we're talking, this was at least 10 years ago or 10, 12 years ago.
uh, 12 years ago.
12 years ago. So, in those days, they had some chemotherapy and probably you had some cyclophosphamide. I don't know whether you had adriamycin, but we know that these medication can affect the heart. And sometimes it's not always that obvious. And sometimes it happens, we see women, for example, we treat with breast cancer, they have like chemotherapy and they cure their cancer. And then 8 years later, they present with heart disease. So, it is possible that some of the medication that you got for your cancer may have influence or affect your heart, in its response to, a heart attack or heart failure or whatever. But anyway, you survived this, which is really fantastic. 6 months, you were cured. What a beautiful results.
I
And
was in remission. After that, you still have to continue doing chemo for a period of time, and then it for what they call maintenance until you get past a certain amount of time. And at first, the chemo is very often, and then after you uh, get into remission, it dwindles off. Less number of treatments, less is getting pumped into you until finally they turn you loose. And that was that was an experience.
Yeah.
I was able to continue working and take care of my kids and such.
And you were
Yeah,
working in the mines, weren't you? I
yeah, at
mean,
that point in time, I'd taken a job as an electrician in an underground coal mine,
hmm,
and
doing night shifts so you could get your chemo during the day. I mean,
that's
wow.
right. I was very fortunate. The management was very understanding and supportive at the mine. They moved me to owl shift, a night shift, and allowed me to basically work 8 in the gate, get in, do my 8, and leave, so that I could leave from the mine, go to the chemo center, sit down in the chair, and often it was 4, sometimes 5 or 6 hours, because as they're pumping it in, depends on how you're tolerating it as to how fast they can pump it in. And sometimes I was in that chair for 5 or 6 hours. Luckily, it was a good napping chair because I needed to sleep. But I get out of there in time to get home, maybe take a little nap, get up, spend time with my kids, and wash, rinse, and repeat. Go right back.
Pretty
Uh,
incredible.
but
Yeah.
I think that helped me, honestly. Uh, I think anytime you don't keep moving, that you don't keep doing something, uh, don't have something to keep you going, it's detrimental to your recovery, whether it be work, a hobby, or whatever it might be. You got to keep on keeping on.
Right.
And it didn't make it easier, but I got through it, so evidently it wasn't too bad.
It worked.
Yeah.
So now, we keep going. You're surviving this and you're doing well. And then you revisited the cardiac arena.
Yes, I did.
Tell us a little bit what happened when you presented with this heart attack. How many years later was that, Houston?
I went to remission around 45, 44, 6. It was 6
6 years after.
years
Yeah.
ballpark, as I was 50 years old. But it was the end of 50. Uh, End of that year in 2018, I was out to dinner with my daughter for her 25th birthday, and we finished dinner, and we're all gathered around talking, and all of a sudden, out of nowhere, I had an elephant sit down on my chest. And you hear people say that, you don't understand it, or don't think until it actually takes a seat. But honestly, I felt a little weak, had the pressure of sitting on my chest, and I was a little winded, but not like you would think, not like I would have expected. But I did recognize signs of heart attack, and we were very close to the ER. So rather than wait on an ambulance and all that, my daughter just drove me straight to the ER, and I walked in under my own power. They got me hooked up. Shortly thereafter, they booked me a ride on a helicopter, and I love helicopter rides, but not that one. And so that got me to you guys, and I received a stent from
Yeah,
there.
that was the Widowmaker.
It was.
Approximately the large myocardial infarction, that it can cause, and a lot of people don't even make it through it, but you did. Again, recognize the signs.
Well, I would preface that with I was really at 50 when this happened. I was in one of the absolute best shapes I've ever been in my life. I was working out regularly. I was eating very clean. Uh, I was really had been at this for a while, maintaining a very healthy eating and activity, doing a lot of what I call outdoor adventuring, and kayaking, backpacking, hiking, such as that, and camping in general. So that, I believe, is what helped me survive that heart attack and remaining calm. I know it's hard to do, but if you can remain calm when something like this happens, it helps you a lot.
Right.
So,
After the heart attack, of course, the, the, the heart attack had damaged the heart, quite a bit, and you developed some congestive heart failure. And, I remember we started some medical treatment. At that time we had mostly, the ACE inhibitors, and we have the beta blockers. You were on aspirin, Plavix, as well as a statin. However, it seems like we were not making headway, in terms of
Well,
heart failure treatment.
I believe what happened was, I think when the original heart attack damaged my heart, no doubt. Because I felt better after stent, but I never felt right. Uh, but it didn't take too long until I had another event. 1 month later, I am on 2059, just about to pass UAB and Bessemer, and my heart went nuts, man. I went to a VTAC storm, and I'm not saying I recommended this to other people, but I was right there at the exit. UAB Bessemer was right there, UAB West. So I hooked on off the off ramp, reached into my console, uh, pulled out 2 aspirin, chewed them up, swallowed them, and even threw my blood pressure cuff on and set it to go, but never looked at it just in case they needed to know what was going on. I didn't know whether they would or not. But I chewed up the 2 aspirin, and I was at the ER and nothing flat. There weren't many parking places. I didn't bother. I went ahead and parked it legally and got on in there. Told them, that I'd had a heart attack a month ago, and right now I'm not sure what's going on. I didn't have the elephant set on my chest this time. And they hooked me up real quickly and realized I was having in a VTAC storm. They lost me once, but brought me back. I think I was back before they thought I was back, because uh, I was witnessing a lot that was going on in an amazing way, and that's a whole other story. It would take too long to get into here, but I don't know if I've ever told you about that.
No.
But we'll discuss it
Yeah.
whenever it's appropriate.
Okay.
But that VTAC, it really took me down. They got me stable, sent me on to you guys, and y'all implanted my cruise control and my bug zapper, my pacemaker and my ICD. I call it my cruise control, and my pacemaker.
Defibrillator.
Yes.
Yeah.
That one really took a toll, and I went down rapidly after that, as you recall. It was very shocking how rapidly I went downhill, lost tons of weight. And you got me in to see the transplant team at UAB.
My very good friend, Jose Telar.
Yes, he moved to Phoenix, I believe it was.
Oh, really? Yeah.
The day after. he met me the day after. That day he met with me was his last day at UAB.
Oh, interesting. Yeah. So anyway, here you are at UAB, and now you started and being involved with the heart failure team, advanced heart failure team at UAB, and particularly with the kind of moving up the step, in the treatment of your heart failure that was really, basically resistant to medication, and this was time to kind of
the muscle was pretty well shot.
Yes,
that's what it boils down to.
And here we started talking about, some of the mechanical ways, to help your heart, and how did you, talk? What was the process on getting you an LVAD?
Well, I met with a doctor, and he went through our options. My brother and my son were with me, and the LVAD sounded like the way to go if I would qualify. Also, my right ventricle was not, as he put it, it was not pristine, but it wasn't horrible. I'll never forget. That's how he put it. And so I had to go in to be evaluated. They admitted me. And I had really, it was like day by day that I was deteriorating. My situation was deteriorating even then, on an ongoing. It was just sliding right on downhill. So luckily I got in when I did. because I wouldn't last much longer. Because within a matter of days, we were at the point where they were had to do an emergency balloon pump to get everything going because my kidneys were shutting down. And then it was go time. It was time to make a decision. Doctors come talk to me, and we discussed it. I wasn't the absolute best candidate, but they qualified me, and so we did it. It was it was rough. It was a rough surgery to recover from. Actually, a lot of LVAD patients that I've talked to that went on to get heart transplants have told me the same thing I would tell you, and that is compared to the LVAD recovery, heart transplant was a walk in the park. It's a tougher recovery in general, but it's doable and it's a wonderful thing. I was very thankful to have the LVAD and have that opportunity to get better, build myself back up. I lost a lot of muscle mass, went from 210 to 160 some odd, 210 muscular to no muscle, no nothing. My son said it looked like Skeletor, and I can laugh about it now. You have to, you know. But the LVAD, wow, I mean, it makes you feel so much better. Within a couple of days, they had me up walking. At first with a walker and with the stand-up walker and all that. Then I graduated to the down low walker, and within a week or so, I graduated to no walker at all. And I was doing laps. About 2 weeks or so out of that surgery, they 2 weeks or so they let me out of the hospital. But to start with, I had to take the test to qualify that I could. You had to walk so much laps in a period of time, and you had to pass physical therapy's test. Well, physical therapy's test, one of them was the stairs test. You had to be able to walk up a few steps and walk back down. And the LVAD had worked so well that I had gone pre-LVAD. I was at the point I could barely get up and walk to the bathroom under my own power, and it just feet away in the hospital room. To a couple weeks later, I'm having this stairs test, and they call me down because I'm taking the stairs too quickly. I was ecstatic. It was such an amazing new lease on life. It comes with its own complications, but they're worth it. If anybody finds himself in for the market for an LVAD, I highly recommend it.
Yeah. I know that, I mean, you had the LVAD, for what, almost 4 years.
Yeah.
Basically,
almost 4 years, 44
yeah,
months.
living almost normally, going. I know you were telling me you were, playing some golf and even
I was going camping with an LVAD.
camping with an LVAD.
I even bought a truck because it had a 7 kilowatt generator in it, so I had my own power source with me, so I didn't have to just go to state parks. I could overland. But yeah, I was working full time with it and still enjoying my hobbies and my family. In the beginning, like I said, I got down to 160 something pounds. So there's a period of time you have to recoup, you have to recover from that. And I was very fortunate to have my son as my caregiver. He actually quit a really good paying job on the road to come take care of me. He insisted that he was going to be the one. And I was very, very thankful and grateful for that. Of course, he ended up getting another really good career there locally. So he's doing very well. It didn't slow him down at all. He just jumped into something else he wanted to do. And that was good to see and good to spend that time with him. But gaining back some weight, I did end up gaining all the weight back, plus a little more. I just didn't store it the same way. It wasn't as much muscle anymore. But I'm working on that to this day. COVID was a big impact because I was actually with an LVAD going to the gym and trying to work out, or I was working out and getting better. And then COVID come along and it shut all that down. I continue to do home exercise, but it just I do better in a gym. Um, so there was that. But overall, an excellent experience. There was lots that come with an LVAD, and had plenty of questions because people were curious. And it was, I made the best of it. I had fun with it because with an LVAD, you don't have a pulse. People can check all they want because the LVAD is a pump that goes into your left ventricle. It has a cannula. It basically bypasses your left ventricle. Your heart's still beating, but the LVAD pump is doing most of the work. So you have a constant flow of blood. Therefore, there's no ba-bump, ba-bump. And I would always have fun with that. For one instance, I was at a conference, and the president of our company, who I have known for some time, he overheard me talking to someone about the fact I don't have a pulse, and he didn't believe I didn't have a pulse. And I said, "Well, I promise you I do." He said, "I bet you $50 you got a pulse because you couldn't be standing here without a pulse." And I said, "I bet." And I took his money. But
That's
things
great.
like that,
Yeah.
I use that to break the ice with people and kind of have a way to explain to them and educate people along the way, because hardly anybody knew what a LVAD was. Most people have no idea. There are becoming more and more out there. So I have run into people that know. Um,
Yeah. Well, of course, there can be. I mean, as normal life as you can get with an LVAD, I think is wonderful. But it's a mechanical device, and sometimes it comes with some complications. Sometimes it gets infected. Sometimes it gets clotted off. It was
those are
forced.
the two big things: driveline infection
Yeah.
and blood clots. So that
Yeah.
you have to worry about.
Tell us a little bit what happened. You're almost 5 years into it, and you're doing some yard work outside, and obviously you were still hoping to have a heart, and
Mhm.
undergo cardiac transplant. How was that waiting? Um, you know,
Well, it was about 4 years in, and the waiting, the beginning, it's a lot of anxiety involved in it, along with the anxiety that's involved with having a mechanical pump mounted in your heart, cable coming out your side, a little computer, and two batteries to tote around all the time. I actually have got the best solution, I think, for that, and that I don't know whether you know what a football girl is, but it's what we used to wear at football practice. It's got the pockets on it for your pads, and then you wear it under your football, whatever you're wearing, shorts or whatever. Anyway, I got me some of those, and my controller went in one pocket, my batteries went in two other pockets, and I wore them under jeans or khakis. And you could tell if you really looked, knew what you were looking for, but most people never even knew I was wearing it. And that's what allowed me to go to the gym. It gives you a lot of freedom. The cable's not hanging loose. You don't have to worry about that. The waiting game is a lot of anxiety, especially in the first several months. I have O negative blood, so that limited my exposure. My opportunity of getting a donor, because O negative, it only makes up about 7% of the population. Of that 7%, they need to be about the same height, build, not exactly, but close. And they also have to have chosen to be an organ donor. And so that's why I talk about that a lot. Choose to donate, and become an organ donor is a big thing.
yeah, being the O negative makes you a great donor, not so much a great recipient.
Yes, it's
A
it's
little harder.
I mean, you're able to, donate to anyone, and
Yeah.
there are studies that suggest that you're more resistant to some viruses, and resistant to dementia, and also resistant to heart disease, although I've had a lot of good that do me.
Well,
But
I think it's the CLL treatment that messed that up.
so so basically, I knew going into it that I was going to have a long wait. The doctors had told me this, and honestly, at that point in time, I had forgotten that I was even O negative. So uh, early on, I called them, called my uh, LVAD nurse, And I asked her, I said, what, this is before I was in the process of getting listed. This is shortly after the LVAD. I'm starting to think about it. And I asked her, I said, what blood type am I? And she told me, oh, negative. And I told her I've never been negative a day in my life, but evidently now I am. So I knew going into it, this was going to be possibly a very long wait. And in the first year, especially, it was a lot of anxiety with it because every time the phone rings, is that it? You're scrambling to get it. And I was still working, and I was doing meetings and conferences and dealing with customers face to face in their offices. And the ones that knew me well already knew when that phone rang, they could just stop talking. I was going to look at my phone. But I had to explain it sometimes. And that there was some, that waned off, I think, as the years went by. I had become very accustomed to being tied to my phone. My phone was with me all the time. Its battery was charged all the time. Had backup with a smart watch that would receive a phone call if this was dead. Phone was dead, I would actually also get the call on my smartwatch. So I had a backup. And
Plus, you were doing well, on the LVAD, and therefore
I was doing very
we're
well.
not so much a priority for a heart transplant at that point. I mean, obviously,
Unfortunately, yes.
yeah. So, some people have
The
LVAD as a destination. I mean, that's all they get, of course, and
right,
you could go years like this.
right. Two ways with the LVAD. You're the destination therapy, which you can last for a number of years and have a really good quality of life with your family and whatnot. So it's excellent for that. But it's also a bridge to transplant, and that's how it was used in me. And that bridge was a very long bridge, but we got there. And over time, the anxiety off of it let up. But it was always there. And then finally, um, I didn't actually get the call like someone would think. I actually did the call because the initial call to get things started, because I was actually on a ladder trimming some limbs off so they wouldn't block my security camera, and my alarms started going off on my LVAD, loud and proud. I mean, it was you can't miss it. And so I got down and looked at it and said, call. Basically, the gist of the message was call us right now. So I did that and spoke with them for a moment, explained what was going on and how I was feeling. And they said, you need to come on to the hospital. Don't drive, pack a bag. So I went ahead and threw some things in a bag. My mom drove me over there. I felt like I could drive, but whatever was going on didn't say I could. So I did not. Was admitted. Shortly thereafter, they said, well, you can't leave without a heart transplant. I started having a lot of VTAC events and VTAC storms, and they were having me on IV medicine to try to control them, but it was becoming challenging even with the medicine. But they did finally get it dialed in where they had it under control. They told me, make yourself at home. You could be here for months. And thankfully, I was not. I was only there 2 to 3 weeks. And that's when I got the in the hospital call. They actually called my cell phone and told me what was going on. And that they thought I was going to get it. As anytime you get a call with a heart transplant, you don't know that you're definitely the one, because there'll be a few people in the pool, maybe here, maybe in Atlanta, maybe in Memphis, maybe somewhere else, or Nashville. So you have to understand that. But the fact that they moved me to a 1 because I was so difficult to keep stable, really, that bumped me up. So I got the transplant, which was a surreal experience in and of itself. A lot of someone had asked me before this, how are you going to do that? How are you just going to go in there and lay down on a table knowing they're going to rip your heart out? And I said, well, that's so had. I've already been married twice, so ripping my heart out ain't no problem. He but I did just that, and it's an experience that you prepare yourself for along the way. You know it's coming. You know you're gonna get hard. You know you're gonna get better, and so you look at the other side of that problem, and you get there. But it really wasn't a difficult decision on any of it because I had come to a point that I only had two options, and one of them was live, and the other one wasn't so
Easy
good.
choice.
So
Yeah.
um,
How long were you in the hospital? And what
uh,
was your post-operative course?
after post-op, they actually said I got out faster than most. I was only in there about 2 weeks,
Yeah.
and what that was a whole other joyful experience. It was amazing. Um, I, uh, recovery, of course, was rough. I had some gut issues. I think the anesthesia put everything to sleep, and it took a minute for everything to wake up. Um, and so they worked on that and got me past that, and my heart was doing great. I was up walking. They get you up walking like real quick. I mean, very quickly they get you up walking, and so I felt like I was really a new lease on life. I went from the LVAD, which did a great job for me, to now I have an actual heart in my chest, thanks to my donor and their family.
You did some cardiac rehab with other cardiac patients or other
Oh
cardiac,
yes.
heart recipients or
hmm I did it at UAB, at the Spain Rehab Center, and I met a number of other patients in there. I met one lady. She was only in her early 30s at best. Had small children, uh, and she just got a heart transplant the week before I did.
mm,
All right, she got it put out of the hospital a few days after I got put in. We never met in the hospital. Um, so and many others, and heard their stories and told my story, and that's when you go to cardiac rehab and the other patients that walk the road are there. It does you good, not just physically there, but mentally and emotionally to exchange stories and such as that of the journey.
yeah, I think it's a fabulous support group. As a matter of fact, that's one of the main reasons why I try to send all of my patients to cardiac rehab, whether you recover from a heart attack or whether you have heart failure. Here, I can imagine what it would be to get with a group of, people just went through the same thing you did. I mean, it's the effect, the positivity and, the support. And it becomes like a support group. I mean,
And
mental.
there are support groups for transplant and such that. I've not actually gone to any of the support groups for transplant. I was involved with during the LVAD. We had regular LVAD support group meetings, and those were excellent. Made a lot of friends who had LVADs, have stayed in contact and become very close friends with a couple of them. So that was really good. It's good for an LVAD patient. Or so.
Yeah. Well, now, you walk down the street, nobody would know that, you have a 21-year-old heart, in you.
Right.
By your business completely normal. And
I tell people when they ask how old I am, I'm telling them 38 because I'm taking the average.
actually, aren't you the age of your heart? That's the
What's
case.
that?
Aren't you the age of your heart? So, and
Well,
that,
there's more
in
to
that
me than
regard,
the heart, though that is the big thing. So I take the average because nobody's
yeah.
going to believe, well, by now 22 years old, nobody's going to believe that.
Obviously, you have to take medication. You have to kind of follow up with your team, and there's many biopsies here. How's the life, of a transplanted heart patient?
Uh, well, for me, it's good. Really awesome, actually. Of course, you have the medications, and there in the very beginning, there are so many. Um It's a lot. It's still a lot to this day, but in the very beginning, it's a lot. It's still a lot to this day, but a lot of medicines have dropped off. I can fit all my medicines in a regular sized pill box now for the day, for that time of day. Whereas before I could not. There was a lot, but and they do come with their side effects. Each one can present a different side effect, and it's different in everybody. Some people have certain side effects and not others, and vice versa. Um, and most everybody has side effects from the steroids, which is to be expected. My favorite side effect is getting up every morning and breathing. I really enjoy that one, so I don't mind taking them.
Enjoying
Uh,
a new day.
no, not at all.
What about the cardiac biopsies? How frequently do you have to do that? And what's your experience as a patient? You go to the hospital? Is it like a special place? How is it done? Does it hurt? What is the experience of that?
Well, in the beginning, you go to Kirkland Clinic. You don't actually get admitted to the hospital, but in the beginning, it seems like you're having them every couple of hours, but it's actually uh, every. In the beginning, it's twice a week, and then that dwindles down to once a week. Then it's once every 2 weeks for a while, and it progresses. At this point, I'm oh, what am I? 18, around a year and a half out. And I've been on every 3 months for a while, once every 3 months. Um, I'm scheduled again next month, actually. Honestly, they're not something I would just book on a spa day or anything, but you get used to them. I've come to, you have so many in the beginning and then it dwindles down, but you end up knowing the people that are generally in there doing it, the staff inside. So, I walk in, it's like Cheers, everybody knows my name. Um, and they do a good job. They numb up. They go in right around here. I've got a little scar
In
that
the neck? Yeah.
in my neck because they've gone in so many times. It's not noticeable, but you go in, they numb that up real good, and they go to doing their job, putting in the sliding in the catheters and wires, and um, I'm everybody's experience is different. Um, it's uncomfortable, but it's not painful. The shot in the beginning to numb you up is just like going to the dentist. That's pretty much the worst pain part. And I had been very interested in what was going on, so me and Dr. Talaj, when he does mine, which is I get him at least half the time. Uh, we'll pick back and forth at each other, and I'll try to count how many biopsies he's pulled out. And just, it can be a real stressor, but I try to look at it as just a means to get the results, which are reassuring. You find out that, yeah, everything's okay. Most of the time, there can be rejection to deal with and such as that. And I went through that. A lot of transplant patients do, but it's very treatable. And that's the point of having, the further you out from transplant, the less your chances of rejection. And that's the reason that they do them so often in the beginning, and then it dwindles down over the years. I think at 5 years or so, you're just coming once a year. Uh, so right now I'm every 3 months. Shortly, I'll be every 4 months.
Not bad at all. And
Yeah.
and I know you've been through a rejection, period. It was treated. It was, a little tough to treat, but they really kind of, poured the kitchen sink and, and really did.
It was persistent.
That was
But
last Christmas, wasn't it?
yes, it was actually the last time I was hospitalized twice. I started off by doing steroids at home, and for most people that'll knock it out. For whatever reason, mine decided to be persistent. I had originally I was in the hospital, but it's because I had appendicitis, and then I went on to have my regularly scheduled biopsy the following week, actually, I think it was later that week after I got out from the appendicitis, and I had rejection. So they had me take medicines I already had available to me at home, steroids, but higher doses for a few days, and that normally knocks it out. Mine was persistent, so I had to go back for another biopsy. It said rejection. This time they put me in the hospital, steroids, another biopsy rejection, put me back in the hospital. And this time I had a couple of options, but I chose, as one doctor put it, a 10 megaton bomb of steroids to knock it out completely. And so I got that and it did the job. I got out on Christmas Eve, went back the 28th and had another biopsy, which said all clear. So,
Yeah, pretty fantastic. Well, it looks like throughout this course, I mean, what's very apparent is your resilience and your approach to problems that has really kind of helped you fight, the AFib, the cancer, the heart attack, and all your experience, recovering from the heart transplant. We know that there's a growing body of research that's linked positive emotion and optimism the way that you have, like life satisfaction, is relate this to better cardiovascular health, reduce risk of adverse outcome in patients with heart disease like you had, as well as lower incidence of cardiovascular disease in the healthy population. I mean, I know you've been a proponent of not even talking about hope, but I mean, you were against hope. I mean, you've like,
well, I was kind of tongue in cheek. It was an attention grabber on a post I made where I was making the point about being positive, and it worked. It got a lot of attention, and a lot of people ended up responding to that and reacting to that post and contacting me and telling me their story. A number of people did, so it did its job. It got that out in people's mind, and that's something I'm a proponent of trying to put out there. I do stand up comedy, just open mics and such as that, but that's a big thing I push in my stand up comedy, and and I talk about some of the health issues, and it really it feels good, and it feels like it's something I should be doing when someone comes back to me after hearing my story, either from someone else or from me, or on through comedy, and says, "Hey, I'm really glad you said that." One guy come up after a show, and he had to be helped up there because he was starting chemo the next day. He was in pretty rough shape, but I had just made a lot of laughs out of cancer, and it helped him, and that helped me in turn. As a community, whether it be cancer or heart, other patients are really a source of strength. They have been for me, and I encourage any patients to reach out to your fellow patients, your fellow survivors, and have these discussions because nobody understands you and what you went through any more than your peers in that situation.
Yeah, very important message. And we hope that you convey that to a lot of patients that are going through sometimes some rough time, and you can't do anything. I mean, they happen in any ways, even if you have you're doing everything to prevent them from happening. You can't predict heart attack, for example. They happen, and people that take care of themselves, but the outcome is really different. The way you approach the healthy lifestyle and being positively minded can really help with your recovery.
And I have to
Right.
say that during those times, when you're in the heat of battle, the re- remaining positive, uh, keeping that positive outlook, is a battle in and of itself. When you have all the negative outcomes coming at you that you got to beat, but it's a battle worth winning. It's one you got to win. Uh, you know, that those dark thoughts starts creeping in. Get up, go talk to someone, bounce a ball, something disrupt your thought process and get back on track. It's those kind of things actually work. They sound a little hokey, but it's true. Disrupt that thought process, find a way back on track, and I believe that it positively affects your outcomes, but at the very least, it improves your quality of life.
Yeah.
The
A
very
journey of
least.
resilience, with from heart attack to heart transplant with the Houston deal. Houston, thank you very much for your time. Really appreciate your help.
All right, man. I really appreciate you over the years, and we'll talk again soon.
Sounds great.
To learn more from our team of cardiologists, please visit us at MyHeart.net. You can also follow us on social media by searching MyHeart.net on Facebook and Twitter. And be sure to subscribe to this podcast so you don't miss our next episode.